Blood administration. According to the Blood Product Transfusion Administration Consent and Reaction Policy, CV number 270, an RN or LVN is responsible for the administration and checking of blood, platelets, FFP, and cryo. Refer to our Skills in Clinical Nursing 7th edition, pages 511 through 516. Blood products are administered through a blood filter. Platelets and cryo are administered with platelet infusion set. 2 licensed personnel will confirm patient identity at the bedside. Patient verification must be identified utilizing the 2 patient identifiers at the bedside. With blood administration, you must have a current consent by a physician or an RN, order, a type and cross, patent IV, and 2 licensed personnel to verify patient and blood. An IV pump or a syringe pump or a gravity flow or component administration set, blood product, blood tubing, filter, and normal saline. Administer blood products via a 20 gauge or larger IV needle whenever possible. Cross match expires 3 days after time of specimen collection at midnight. Return to transfusion services if not used within 15 minutes. A licensed staff must accompany a patient if the patient requires transport while blood or blood products are being administered. In an emergency situation, 2 physicians are responsible for documenting the need for blood product transfusion to save the life of the patient prior to obtaining consent. The decision must be clearly documented in the patient's medical record. Refer to the Standard Policy and Procedure Patient Care number 17 for the information regarding informed consent. During rapid transfusion of blood, the compatibility tag can be labeled as emergent transfusion in lieu of documentation of required vital signs. If the patient refuses to permit a blood transfusion, the patient or legally responsible representative must sign the last statement of the disclosure and informed consent form, which states that the risk of refusing the transfusion were explained. A competent patient's refusal must normally be honored regardless of the grounds upon which the refusal is based. When ordering blood, BB transfused will be placed by the provider when it is determined that the patient needs to be transfused with blood products. BB send blood product will be placed by nursing staff or HUC when they are ready for a blood bank to send the blood to the unit. BB cancel will be placed when the patient is no longer in need of the blood product. Transfusing of blood products. Compare the name and the medical record on the tag to the patient's hospital band. These must be identical. Compare the donor type and donor number on the tag to that on the blood product component label. They must be identical. Verify that the product is compatible with the patient's blood type. Transfusing of blood products. Make sure that you document the start date, time, and vital signs. Stay with your patient for the first 15 minutes and monitor closely for any signs and symptoms of a transfusion reaction. Document vitals at 15 minutes, 30 minutes from start time upon completion of transfusion and 1 hour post-transfusion. Document volume employed as well. Transfusion of blood products. The tag must be completely filled out before attaching to patient's chart for scanning. All transfusions must be completed within 4 hours. Filters are only good for 4 hours. In the event of a blood transfusion reaction, you would want to stop the transfusion immediately and monitor patient closely. Keep the IV line open, notify the physician, notify transfusion services, keep all blood products at patient's bedside. Completely fill out the form that will either be sent or brought by the transfusion staff. Obtain a post-transfusion urine and blood sample and send to transfusion services. Possible reactions with blood transfusion include fever, chills, flank pain, reddish or brown urine, new onset that is, tachycardia, hypotension, headache, anxiety, nausea, and dyspnea. Make sure that you document the reaction. Time infusion started, time adverse reaction suspected, physician notification including time of notification and orders received, and description of signs and symptoms of the reaction. This is an example of what the blood component chart looks like. You may find it attached to the CV Policy 270.